Question 11. A client with DKA has fruity-smelling breath. This is due to A. Hypoglycemia, B. Ketone production, C. Lactic acid buildup, D. Dehydration. Answer: B. Ketones cause the characteristic fruity odor. Question 12. Which position is best for a client in shock? A. Supine with legs elevated, B. High Fowlers, C. Prone, D. Side-lying. Answer: A. Elevating legs improves venous return and perfusion.
Question 13. Which finding indicates fluid volume overload? A. Dry mucous membranes, B. Bounding pulse, C. Decreased urine output, D. Poor skin turgor. Answer: B. Bounding pulse suggests excess circulating volume. Question 14. A client with chest pain receives nitroglycerin. What is the most important assessment? A. Pain level, B. Blood pressure, C. Respiratory rate, D. Oxygen saturation. Answer: B. Nitroglycerin can cause hypotension. Question 15. Which isolation precaution is required for tuberculosis? A. Contact, B. Droplet, C. Airborne, D. Standard only. Answer: C. TB spreads via airborne particles. Question 16. Which sign indicates hypoxia? A. Restlessness, B. Bradycardia, C. Pink lips, D. Slow breathing. Answer: A. Early hypoxia causes restlessness and anxiety. Question 17. A client on heparin has APTT above therapeutic range. What should the nurse do? A. Increase infusion, B. Stop infusion temporarily, C. Give vitamin K, D. Continue as ordered. Answer: B. Excessive APTT indicates bleeding risk. Question 18. Which vaccine is contraindicated in pregnancy? A. Influenza inactivated, B. Tdap, C. MMR, D. Hepatitis B. Answer: C. Live vaccines like MMR are contraindicated. Question 19. Which symptom suggests increased intracranial pressure? A. Tachycardia, B. Widened pulse pressure, C. Hypotension, D. Shallow breathing. Answer: B. Part of Cushing's triad.